Welcome, and I hope this finds you in good health. You'll be with me, your dietitian Gilbert Gaston, a clinical nutritionist and dietitian from Tanzania. Well, as of today, we'll be talking about healing through nutrition, and our main focus will be on necrotizing fasciitis. We'll have an overview on necrotizing fasciitis and its nutritional management, on how a clinical dietitian, will have to go on managing this necrotizing fasciitis patient and have a successful management. So the first thing is we should understand what is this necrotizing fasciitis and what causes necrotizing fasciitis. This is a rare but very severe bacterial infection affecting the tissues under the skin, and the common cause is group A Streptococcus pyogenes and the Staphylococcus aureus. These are methicillin resistant Staphylococcus aureus. The Staphylococcus aureus are normal flora, just among the normal flora, but when they're in excess, this can lead to the necrotizing fasciitis, and this case is mostly common among individuals with compromised immune system. So the symptoms of this necrotizing fasciitis before it really occurs, you'll sense severe pain around the tissues of the skin. Let's say around the thigh skin or around your feet, around the neck or on your arm. So the area where you're infected, actually, you'll experience severe pain, redness, swelling. These are very common symptoms that you will witness. And also you'll have fever times and blisters or ulcers around the infected area. So what is very important to know if this is necrotizing fasciitis or just any other skin disease. It is very important to have early diagnosis and treatment. This is very, very important. So if you see similar changes like this, like redness, swelling, and blisters around your skin, then it is very important that you rush to the hospital for a checkup and confirmation. So skin grafting is the common treatment for necrotizing fasciitis, and nutritional management is where starts working here with the skin grafting. So nutritional management is vital for healing and recovery. There is no way that medications to reduce pain will help you to recover on the tissues that you have lost. They only help you with reduction of the pain. But the nutrients, the protein, the antioxidants are the ones that will help you to regain back your lost tissues, will help you to have a good attached skin graft. So, and the key focus of the nutrients will be high protein and high caloric diets. So that is the main key focus when managing a skin grafting, especially for a necrotizing fasciitis patient. So when we start with the high protein diet, the importance of this high protein is to support the tissue repair and immune function. Remember, this person with necrotizing fasciitis is at probable risk of having different infections because the skin is necrotized and very prone to infections. Yes, so we have to boost the immune system of this patient, but also we need to repair the tissues as much as we can through protein. And the protein needs in necrotizing fasciitis patient actually are a bit higher than a normal person. A normal person requires at most 0.8 grams per kg. But here in necrotizing fasciitis, according to the condition of the patient, a dietitian that will face, then the protein needs will actually range from 1.2 to 1.5 gram per kg per day. So if your patient has an actual body weight of 65 kg, this means that you will take the 65 kg multiplied to 1.2 or 1.3 or 1.4 or 1.5. So you will have to assess your patient so as you can know how much protein this patient really needs. And this is for trauma cases. And the sources for high protein would be the lean meats, fish, eggs, dairy, legumes, tofu. So all that, you'll see how you can actually have a good meal plan with high protein. And supplements that can be used in this case are Maxivida, Recover, and Life Gain. These are high protein supplements that you can prescribe for your patient and have some good improvement with the skin graft. So the other fact was adequate caloric intake. With energy needs for healing for this necrotizing fasciitis are a bit higher again. So we are aiming for energy from 30 to 40 kilocalories per kg per day. So remember, it is very, very important to use the Harris-Benedict equation because it incorporates the stress factors, the activity factors, but as far as I have been practicing in the at Muimbili for the times that I've been in several trainings, I've seen the requirements on energy requirements. They range from 30 to 40 kilocalories per kg per day. So this is just a guide, and you'll see how your patient really needs. It can be lower than that, or it can be higher than that, or it can be, most of them will range from 30 to 40 kilocalories per kg per day. And the nutrient-dense foods actually include the whole grains, fruits, vegetables, nuts, and healthy fats. So you can see what is the best choice for your patient so that you can manage the case very well. But also something very important not to forget is vitamins and mineral supplementation. Focus on vitamin C and zinc for collagen synthesis and wound healing, respectively. So vitamin C is very, very, very important for collagen fibers formation, and this will help you with wound healing. Yes, but also zinc, very important in skin and wound healing. So multivitamin supplements can be prescribed for deficiencies that will be spotted. Hydration and meal planning. Encourage fluid intake to support circulation and healing. Most of these patients they tend to take little fluids, but also it is very important for a dietitian to encourage on adequate fluid intake to support the circulation and healing process. But also you can have these frequent small meals, like 5 meals per day, of which may have 3 main meals and 2 snacks. But also, why should we have this fluid intake? Just moving back a bit. This fluid intake, encouraging on fluid intake, remember that we have an exposed skin part, or the tissues have been exposed, and this person will be losing out a lot of fluids. So it is very important to encourage on fluid intake. And also with meal portions, remember, it is very important to balance the meals throughout the day so that you can maintain stable blood sugars and prevent fatigue for this patient, because the wound requires energy for healing, but also the person needs energy for other systems to function as normally as possible. So we should have balanced meals throughout the day so that this person will not be in hypoglycemia or hyperglycemia. So the other thing is monitoring their nutritional status. This is very important. You should have regular assessments for weight, protein levels. You should be able to spot any signs of malnutrition or infection, and this should be done daily. It is very important. Use tools like MUAC, the mid-upper arm circumference readings, to track the progress. I remember one of my tutors, the lecturers, the dietitian Nimtas Waljigiga, used to emphasize on using MUAC to spot any changes to the patients that we were actually dealing with in the hospitals. So MUAC is very, very important to have it as a dietitian. You need to know what is the progress of this patient. Is he getting malnourished, or is he getting better, or is he the same? So regular evaluation of the grafted area, it is very important. When the nurses are dressing the wound, the grafted area, it is very important that you should be there to see how is the wound, how is the grafted area going on, so that you can have a real picture of if the management that you're giving to this patient is working or not working. But also something very important is collaboration and education. Collaboration, this involves working closely with other health professionals for optimal support. The doctors, the pharmacists, the nurses, and everyone in the team. It is very important that you work with them closely as a dietitian for effective management of your patient. But also educate the patient and caregivers on the importance of nutrition in healing, and practical dietary strategies. Most of the people tend to see nutrition as just you can eat anything, but it's not that you can eat anything. You have to eat according to the requirements. And when dealing with critical cases like necrotizing fasciitis, skin grafting, then it is very, very important to have all the tips on how to manage that patient. And these tips should be given to the relatives and also the patient themselves. Furthermore, proper nutritional assessment, management, they all enhance recovery, good recovery, but also standardized approaches to improve outcomes for post-skin grafting care are very, very important. I would like to acknowledge the University of Dodoma in Tanzania, Muhimbili National Hospital, where I've had my several trainings over there. Nutrition Television Africa, joining over 20 countries in Africa with nutrition knowledge students and so forth. But also I would like to acknowledge Tanzania Clinical Nutrition and Dietetics Students Association, TACNUDISA, Medical Council of Tanganyika, much appreciations for nurturing the clinical nutritionists and dietitians in Tanzania. But also I would like to acknowledge Body Mind Insights in Tanzania, of whom I am working with mostly with body composition analysis and nutrition and fitness consultation purpose. Well, welcome. You can subscribe to our channel, and for any question, comment, suggestions, opinions, the comment box is yours. Thank you very much. Have a good time. Let's meet in the next presentation. It was me, Dietitian Gilbert Gaston, your clinical nutritionist and dietitian from Tanzania. Thank you very much. Au revoir.